Hi, my name is Chelsea Phillips, and today I'm going to be talking to you about the physiology of breastfeeding. Throughout this lecture, I'm going to first discuss the anatomy of the breast and the breast tissue. We're going to talk about the two major body systems involved in breastfeeding, the nervous system and the endocrine system. And then we will be discussing milk production versus milk ejection and how this all works together to create the process of breastfeeding. So first, I really want to talk about breast anatomy. I feel it's really important to understand the anatomy of the breast and the tissue itself so that you can understand how milk travels through the breast. So the breast is composed mainly of adipose and collagenous tissue, along with mammary glands. And mammary glands are modified sweat glands. And mammary glands have a lot of different components to them. So they've got milk transferring lactiferous ducts, and during pregnancy, these lactiferous ducts expand and branch out throughout the breast. The breast alveoli ducts are balloon-like ducts that also expand into the chest wall during pregnancy. And this expansion leads to some of the breast growth that you see during pregnancy. So in the breast alveoli ducts, there are milk-secreting cells that are surrounded by myoepithelial cells that contract. So I just want to go through a quick process here of how milk travels through the breast. So it goes from the lactocytes to the breast alveoli. It's then squeezed into the ducts, and then it is secreted through the lactiferous sinuses, which meet at the nipple pores where milk is excreted into the infant's mouth. On average, each nipple will have about 4 to 18 nipple pores, and that is why you see milk. If you've ever seen milk spray out of a breast, it doesn't just come out in one stream. It kind of just sprays everywhere. So that moves us on to how does the body make breast milk, milk production. So there is a part of the brain called the pituitary gland. It is located between the hypothalamus and the pineal gland, deep in the brain. And the pineal gland receives messages from the hypothalamus to create, to make and to release different hormones throughout the body. And the main hormone associated with milk production is prolactin. So during pregnancy, the brain pituitary gland is signaled to release prolactin hormone. So prolactin hormone levels begin to rise by about the 5th week of pregnancy, and they continue to rise until the end of the pregnancy where they plateau. And at this point, the prolactin levels are high enough to signal the body to make milk. However, milk production is inhibited by the high levels of female hormones, estrogen, progesterone, etc. So milk production isn't signaled to start until the placenta is expelled during birth. And that is when your body is told, hey, make milk for my baby. But it doesn't happen immediately. It takes a little while. And so during pregnancy, your body has made a fluid in your breast called colostrum. And this is a yellowish, sticky fluid that's high in glucose and will satiate your baby's hunger and thirst for the first few days of life until your mature milk comes in. And typically that's by about day 4 on average, give or take, depends on the situation. So each time the infant suckles at the breast, the prolactin levels will spike, and this will signal your body to make milk for the infant's next feeding. So that moves us on to the milk ejection reflex, or milk letdown. How is milk released from the breast? So when an infant suckles out the breast, sensory nerve fibers in the areola and the nipple are stimulated, and this sends afferent signals to the hypothalamus, which then tells the pituitary gland to make a hormone called oxytocin. Oxytocin is often referred to as the love hormone. Its levels of oxytocin raise during bonding, intimate relationships, sexual behavior, and also during milk ejection. So When the oxytocin is released, this stimulates the myoepithelial cells in the breast ducts to contract. And when the myoepithelial cells contract, they squeeze milk from the alveoli to the lactiferous ducts, and milk collects in the lactiferous ducts and then is transferred through the lactiferous sinuses and finally excreted through the nipple pores. So this process of milk ejection is a positive feedback loop occurring between the nervous system and the endocrine system. Um, and the process on average from suckling to letdown takes about a minute. You know, infants are really effective with their suckling. Um, so I just want to review what we have discussed today. I first touched on the anatomy of the breast, the composition of the breast tissue, and um, the different components of the mammary glands. We talked about milk production, how prolactin levels rise during pregnancy, the placenta signals the body to produce milk, and how suckling on the breast from the infant um, produces spikes in prolactin, which tells the body to make milk for the next feeding. And this is a supply and demand system. So the more the infant suckles, the higher prolactin levels, and the more milk will be created for the next feeding. We also discussed milk ejection reflex and the positive feedback loop between tactile stimulation and oxytocin release in the pituitary gland, and how this causes the myoepithelial cells to contract and release milk from the breast. And we also discussed how this is one of the body's few positive feedback loops. There are a lot of negative feedback loops in the body, and this is one of the few positive ones. So I really want to emphasize that. I hope that after this lecture you have a better understanding of the physiological process of breastfeeding and how the nervous system and endocrine system really work together to make this happen. Thank you.